I'm Dr. Daniel Fahim. I'm a brain and spine surgeon with Michigan Head Spine Insitute. I just want to do a short little video to talk to you a little bit about the thoracic spine. This is the part of the spine that's attached to the rib cage, which of course contains our lungs and our heart. There are several things that are kind of unique to the thoracic spine that are worth discussing. One is that the weight of our body kind of sits in front of the thoracic spine a little more so than the lumbar and cervical spine, which kind of causes it to be kind of pulled forward. And that's one of the reasons why we see some of the anatomy and problems that we see in the thoracic spine, some of the pathology that we see in the thoracic spine, specifically compression fractures. These tend to affect older patients more frequently than younger patients, especially as we get older and our bones sometimes become weaker with osteopenia or osteoporosis. That can result in weakness of the bone and fracture of the bone where it collapses and kind of forms a wedge where it collapses like this because of all that extra weight of the body in the front. And when these bones collapse, they can cause a tremendous amount of pain. And when multiple bones collapse in this manner with thoracic compression fractures, then patients develop that kind of hunched over, stooped over posture that is so frequently seen among the elderly population, especially folks with weaker bones. So one of the things that we can do to treat those types of compression fractures and to help those patients with both their pain and with their overall global spinal alignment, correcting it so that it's normal and they're not hunched over, is something called a kyphoplasty or a vertebroplasty, which allows us to access the vertebral body with a percutaneous approach, meaning a tiny little incision, smaller than the size of the tip of your pinky finger, just a tiny little 3-millimeter incision that allows us to access the spine and reduce that fracture, correct that fracture, and then put some cement in there to stabilize it. And that helps treat patients' pain as well as prevent that progressive kyphotic deformity that can develop when we have compression fractures. And that's actually a very short, quick procedure that can be done in 20 or 30 minutes, and patients can go home the same day. And it's a very safe procedure even for our elderly patients. One of the other things that can happen in the thoracic spine, which is pretty rare but can be pretty debilitating, is a thoracic disc herniation. If one of the discs in our thoracic spine herniates back and presses on the nerves that come out from the spinal cord at those levels, we get a numbness and a pain that wraps around from the back of our rib cage towards the front. And it can happen on either side, of course, depending on where the nerve is being squeezed, and that can be pretty painful. These are pretty challenging operations to do. Historically, people used to have to go through the chest to remove these discs off of the nerves and take the pressure off the nerves. The way that I perform these operations and other modern trained neurosurgeons who are comfortable with minimally invasive techniques is that they will approach these thoracic disc herniations with a minimally invasive tubular approach. And we can use a tube to access the spine and specifically address the area of pathology, remove the disc and some of the surrounding bone above and below it, and take the pressure off of that nerve through a very small, minimally invasive incision and relieving our patient's symptoms in that way.